then mediastinum, and also D1 and D2, right? Hello?
We can hear you.
Okay. So objective here was instrument intubation, reaching the D2, scope handling, then going into stomach, identifying structures, and going to D1, identifying the portal vein, CBD, or whatever is one of the major structures there, and then follow them clockwise, anti-clockwise, and then going into D2, and then identifying aortas, inferior vena cava, and then finding the uncinate. This patient has chronic pancreatitis, and he's been referred to us because he's got severe pain, and so he was referred for celiac block. Okay, while we were doing this, and then the next thing was, and Dr. Saab will do it now, was to go to stations in mediastinum, so look at subcarina, and so we just show the subcarina now. Pull back करेंगे थोड़ा सा. That's it. Anti-clock करेंगे, so we will have mitral valve, right? We've got clockwise, slight clockwise, नहीं, anti-clock से अब clock करें. ठीक है, और clock करेंगे, so you'll see the aortic valve. ठीक है? Yeah. Now we're not really interested, we're not cardiologists, so we'll come back and just let go of your big wheel a little bit. So we'll show you what I was just telling Dr. what happens. Air निकालें please. And Dr. साहब ने अभी आप लोग जब तक कैमरा नहीं आया था, he was pretty good. Okay, so yeah. See, now let go of your big wheel. Away, big wheel away. Yeah. So big wheel को अब अपनी तरफ ऊपर कर लें बिल्कुल. See what happens when your big wheel is close to you or you're towards you. See what happens to that lymph node. Now let go of your big wheel and take your air out. And we have a big lymph node here in the subcarina.
Yes.
Appreciate it. Now this guy has lost weight as well, and it's a significant lymph node there. Would you agree with that? ठीक है? मुस्तफ़ा, इसको ज़रा.
Yes.
ज़रा इसको हाँ पिक्चर ले. No, wait a minute.
G left. So this is subcarina nodes.
You see there?
This is the lymph node.
So.
Yeah. Aorta, left ventricle, pulmonary artery.
So that's 2.5 by 11.5. Okay, so now what we're going to do is show you the AP window.
So, what was the clinical context here?
Okay, Mustafa, I wasn't expecting lymph nodes here in the mediastinum. The guy has got a chronic pancreatitis, so he's malnourished. एक minute है. Malnourished, and he's got a quite severe abdominal pain because of his chronic calcific pancreatitis.
Okay.
So this is just an incidental finding that we got. So we thought we'll get. So now he's going to do hopefully AP window by himself as well.
So in your practice in this situation, do you sample these nodes over a certain size or?
This is very tempting, and just let me show you the AP window, and then I would, looking at the multiples, we don't hardly, so, नहीं, ठीक है, you've got it on the right position, बिल्कुल सही है, air निकालें, big wheel थोड़ा सा ऊपर करें, वापस अंदर जाएं, ठीक है, we've got it here. Now I would just go pull back a little bit, now under, and we just rotate, okay? Yeah. Now you don't see lymph nodes in the AP window like this.
Yeah.
You would agree. I hardly ever see lymph nodes. So picture please. Even if I look at these lymph nodes, they are more than a centimeter lymph nodes, and I hope you can appreciate. So this is the pulmonary artery, this is the aorta, and this is one lymph node there, and there is one here. Now if we just defreeze and just let go of your wheel a little bit, you see the size of this lymph node when you let go of the wheel. When you bring the wheel close to you, just for the audience, see what happens to the lymph node now, and just go big wheel away from you and air away. So this is a decent lymph node again, and to be honest, I don't AP window, I don't see lymph nodes of this size, can't remember. So I would biopsy from the carina because that's or these, but
Yeah.
look at the size.
No, I agree.
Okay.
In my practice at least, even if it's for some other indication in their incidentally enlarged lymph nodes, especially over like 15 millimeters, 15
Okay,
to
so
20
now-
millimeters,
so
we
now
will sample.
I'm a simple man. We were just discussing that yesterday. So we'll go. What I do is just
You were discussing you being simple?
yeah.
Okay.
Remember? You may not. So
I may have missed that conversation.
Okay, good.
Yeah.
So I usually go to 40 in women and 45 in men
Okay.
for my gastric station. So I go to 45, 40.
Yeah, I remember that discussion.
Okay, good. So keep
Yes.
going into the stomach. So our area of interest is obviously celiac artery takeoff area. So big wheel up a little bit. Right, we've got liver in the center and we are a little bit more in. ठीक है, अब big wheel up करें, थोड़ा सा rotate करते हैं. So liver is right here, right? Now, what I generally do is at this stage you start rotating the scope. Keep rotating, keep rotating, keep rotating, and there is your aorta.
Yeah.
At this stage, I would just gently go in, big wheel slightly down, away from you, and that's your celiac takeoff, and the superior mesenteric artery takeoff. Because we want to do, so if I freeze here, I'll just straighten the scope a little bit, but this is the area of our interest here. Okay, this is where we would go and inject for celiac block or neurolysis. This is chronic pancreatitis, so I'm doing block.
Okay.
If it was, obviously if it was malignancy, then, so you can see that Dr. Saab has actually done everything. I've actually not done, except for slight touching of the distal end of the scope. So he's achieved really all the objectives that we had set off. So now I think I can take scope.
Yes, sure. Thank you.
So this would be with steroids and
So we
local
are using,
anesthetic.
yeah, I'm using 40 milligrams of
This is
Canacort and bupivacaine. I don't know. You have that spray needle, right? That you use.
Actually, I use a standard. I have
Which
read
needle
about
do
it
you
and seen it,
use
but I just
normally?
use a standard FNA needle.
Which one do you use? 22 or 19?
I used to do 22, but now if I feel that there's a safe window, I'll go with a 19. Just
So
to
I try and go with the 19 if I have
Yeah.
a safe window because it's easier for the guys to. So we have no
yeah.
vessel there. This area is okay. So just for the. So we don't need the flow anymore. Is everybody happy with that? Okay, so we can clearly see that, and I'll just put the cursor to show again where I would be going. So this is the area where I would be going. Okay, and once we start injecting, this whole area would go white, so you would not be able to see anything.
So you see that, you think that's a ganglion right
That's
there?
yeah, that's what I.
You can clearly see that.
Yeah, but Khalid, you are obviously both are much more experienced than I am. There are a couple of things that I do with the celiac block, and that is that I sit down with the patient and first of all explain to them that there is 60% chance that this is going to work in you. Because a lot of them will come back with a lot of disappointment when their pain is not settled or it comes back very quickly. I tell them that it will take a few days for it to really work, and it will. How long will it last? I said, I can't say how long will it last in you, but anywhere between 2 months to 6 months, depending on how lucky you are. The reason for that is that there is a significant failure in this procedure, and there is a lot of disappointment when it comes to the patients. I don't know if you agree with that or not, but the other thing is that all these patients that I do again are done under propofol, and what else? I use a 19G needle, standard 19G needle to do this.
Yeah, I think I agree with all that. What I do is usually take a look at the window. If it's a really, really skinny person, and you don't have much fat in there, then I would go with the 22 gauge needle. Also, be careful when you're looking at that area right above the celiac artery. This looks like a nice ganglion. Ganglion
Yeah.
can be a 1 centimeter, 1.5 centimeter sometimes too. But just make sure it's not the left wing of the left
No,
adrenal gland.
we just
So that could be in the vicinity as well. So just make sure that look around that the adrenal gland is somewhere else, and it's not that. Other
so
thing
let me
is,
show you the adrenal gland, if I can. There is the adrenal
there
gland.
it is. So you
Okay.
see clearly it's separate from that.
Yeah.
Okay.
Yeah,
So
we
that
actually
is a
checked that.
ganglion. If you don't see any fluid, any flow in that, that has to be a ganglion. Okay. And different ways. If you see a ganglion, may be preferable to inject right into that.
Khalid,
But many times you're not gonna see a ganglion completely.
Khalid, even if you see it,
Gee.
when I was looking at the literature, first, as I say, I'm not. I think just injecting straight, simple, one side rather than two sides. Ganglion, if you see, fine. If you don't, even then, I mean, the problem is you go into that ganglion, you're going to inject, everything's going to go white. So after that, you wouldn't know really. Am I right?
Yeah, if you inject alcohol.
Yeah.
But if for celiac
But,
block,
but
no.
when you put even when you start injecting saline, is that right? Okay, right.
So I sort of agree with you, Dr. Saad. I sometimes honestly have a hard time telling a ganglion from a node. And secondly, there was
Can you
this.
see the needle coming out there?
Yes.
So I need G. ये ganglion, G hypoechoic areas. Normally you don't see them, to be honest.
And
बिल्कुल नीचे आर्टरी है ना
जी बिल्कुल नीचे artery है. Okay. So you just need to keep that artery in picture.
एंडोस्कोप इसका तो रिफ्लेक्स कम से कम जो ESDP है
So थोड़ा सा the thing is hooking a little bit, so I want to avoid that area. So we are in the ganglion now. Let me just show you the picture. If I can get-
वो मैं उंगली पर सेक्शन पे चली जाती है एकदम तो उस पे इंफ्लेशन पे चली जाती है और ये डिजाइनिंग यूएस में
Can you see the needle there? We are right in the ganglion there. Can you appreciate there? I don't know if you can. Khalid?
So we see the needle.
Okay, good.
Thank you.
So wait a minute. I will just lock this now. And so all my things are locked now and we're ready to inject. Right. Yeah.
आपने नीडल भी लॉक कर दी
Yeah.
First test.
Yeah. So first you aspirate, make sure there's no vessel there. No, and yeah, go inject.
Yes, start and inject, sir. Yes,
See, this is what happens when you've injected a bit of saline, it all goes white. That's what I meant.
continue.
So that should be enough. Go on now. Yeah.
Uh,
About
10 ml.
of saline. And then we're now going to put 40 mg of Anacort. Yeah, okay, go ahead and inject. Yeah, inject.
First test strip.
Inject.
बिल्कुल भी कितना है
5. 5 mg.
5 ml
Yeah. So you see now, once you've injected, Khalid, personally, there's nothing you can see really, so you just keep.
इसका स्नो स्टॉप
yeah.
My mentor actually taught me this.
Let me pass it to your mentor.
क्या किया मैंने?
सर जी आपने बताया था कि इसके बाद कुछ नजर नहीं आएगा.
नहीं, वो
नीडल
अल्कोहल के
हिलनी नहीं
साथ।
चाहिए. नहीं, इसमें भी कुछ नजर नहीं आ रहा ना, देखें.
ये बुढ़ापे की निशानी है।
सर जी, okay, we are done.
Done, sir.
Okay, so we're just going to take the needle out. And Khalid,
जी।
did you see the lymph nodes?
That was a lymph node or a
No.
Which one?
No. When in the
In the subcarina, yes, I did that. See that.
you want me to do an FNA of that? You see that?
हम लोग लगाते हैं.
They're impressive lymph nodes. There are lymph nodes also in the AP window, Khalid. I don't know if you saw. Would you biopsy these FNA? What does everybody say?
Why you wanna FNA?
I'm asking you.
Yeah, exactly. So not for malignancy, but A for lymphoma
My only
or
concern here is
infectious.
my only concern here is obviously is TB.
Yes.
And in a patient who's chronic pancreatitis patient who's actually, obviously not nutritionally not so good, so
There are AP window lymph nodes as
Yeah,
well,
can you see
right
that?
there. And
Right
yeah,
there,
I
can
think
you
in
see
that case, I
that's
probably.
what I was saying. You've got two AP windows.
These are like
these are decent sized lymph nodes.
decent sized lymph nodes,
Yeah, look
definitely.
at this one.
Yep.
So
What I do usually do is, like, if I have a AP window lymph node like this, I would go for that.
you don't go
'Cause
for the subcarina?
You can go for the subcarina too, but when you see lymph nodes in AP window, they may be more.
No, 22G.
You have two actually, है ना?
Yeah, you've got two lymph nodes here. And both are, the one is obviously 2.2 centimeter in size, we just measured it.
FNA or FNB?
Uh,
A ही है।
FNB.
टिश्यू अच्छा मिलेगा?
Yeah.
कोर मिल जाएगा?
कौन मिलेगा?
I want some saline as well, gene tech please, gene expert for TB, okay. So you can go back to the next room if there's something interesting going on there. But I thought AP window mein lymph nodes, this is actually, to be honest, I really can't remember when I last saw such big lymph nodes in AP window. Because we don't deal with the
This lymph node
pulmonary-
is very pathological looking lymph node.
Yeah. So, I mean, like Khalid said the other day, that ये क्या है? Acquire 22. Okay. So we are using Acquire 22.
I think that's a good choice.
राउंडेड होते हैं, हाइपो होते हैं.
शॉर्ट एक्सेस छोटा है ना? शॉर्ट एक्सेस मैटर ही नहीं होता।
अच्छा।
शॉर्ट एक्सेस मैटर।
ओके. शॉर्ट एक्सेस ज़्यादा हो फिर malignant के चांसेस हैं. फिर वो खुद ही राउंड हो जाएगा.
तो इसका हाँ
Now, Khalid, you told them that you should not be playing with the
वो
sheath. In this case, the sheath actually was not where it should be. So I actually, if you saw the sheath coming out here,
Yeah.
I usually bring it out there and then I take it back. And
If you're not getting a good trajectory, it's fine to go for subcarina too. That is quite
no,
big.
I think it's okay.
Okay.
It's just that
So
the,
image को थोड़ा बड़ा कर लें तो ज़्यादा
अभी
आसानी
कर
हो
रहे
जाएगी
हैं,
आपके
2
लिए.
minutes.
And
Okay, and we need a flow. Sorry. एक दफा फिर मुझे फ्लो दे दो. Okay, perfect. Happy? Okay. इसको ज़रा सा स्कोप को यहाँ सिर्फ हाँ बस ऐसे पकड़ लो बस. You can see the needle coming out. Yeah. So इसको तो हिलाना नहीं है प्लीज. Okay. Good. Oh, it's hard.
you have a balloon on the scope or no?
No.
Yes.
Yeah, there is. You want me to inflate it?
Inflated.
हार्ड है. उसके ऊपर स्लाइड कर रहे हैं सर.
It's a little hard. I was expecting this to be soft. Yes, I've got the balloon. Does that help, Khalid?
Yeah, I think if you pull the scope back a little bit
Yeah, I've just pulled the back.
and big wheel towards you, maybe a little bit more, right here, and
I
You
thought
can-
this lymph node was going to be soft, but it isn't.
Just quick.
Style it off, sir.
Yeah.
Right, sir.
चला गया हाँ अब चला गया
Okay, so we are in the lymph node.
Yeah, I think that just the lower part of it, right?
Yeah, for now, yes. So I've got one area, but it's not as soft as I thought. Okay.
Right there is bad. Now you are in perfect place. Yep. There you go.
very nice
Hard or something?
No,
You can
अंदर से तो
change the
soft हो
trajectory
जाते
a little bit. Right there. Good.
मतलब जाते हुए probably थोड़ा सा angulation
And you can see that the tissue is, the
perpendicular
needle is
faces
cutting the
हैं,
tissue.
slide
It
कर रहा था।
stops and then moves.
बड़ी अच्छी biopsy हो गई so you just tenting the artery अगर ये आर्टरी पे चला जाए तो you just tenting
That's it. खालिद एक क्वेश्चन है जिसका जवाब मुझे नहीं पता.
कैप लगाइए.
खालिद
जी
एक क्वेश्चन आया इसका जवाब मुझे नहीं पता, ये आप ही दें. अगर ये पीछे जो चीज़ नज़र आ रही है नीडल इसमें चली जाए तो क्या होगा?
नहीं, इसमें नीडल नहीं जाएगी आपसे.
किसमें
ये जो चीज बड़ी काली सी नजर आ रही है आपको
नहीं जाएगी?
ना,
चलो शुक्र है,
इसके लिए बड़ी मेहनत करनी पड़ेगी.
जवाब मिल गया सर.
Not that you can't do it.
No, if it was a
कुछ complications होती हैं कि उनके लिए really बड़ी मेहनत करनी पड़ती है.
but these are very impressive lymph nodes in AP window really, नहीं?
It is.
I'll have to do one more pass for saline. जो कुछ भी मैंने सही किया उसका क्रेडिट खालिद को है, जो कुछ भी मैंने गलत किया दैट्स मी.
अच्छा साथ में जब आप ये सीरियस ब्लॉक किया
सिर्फ इसको जरा सा ऐसे
करके वापस निकाल लिया था या
नहीं, you just stay there. You don't want to move. Once celiac block में once you've got your needle in position, nothing should move. Inject everything out. Yeah. Because ये जो patients होते हैं ना chronic pancreatitis के और जिनको CA pancreas में बहुत severe pain होता है, they are really desperate and the pain is bad. Pain management in our country is really, at least is not really good. So जब उनको ये hope मिलती है ना, oh really से pain, so they come with a lot of hope, and that's why I think it's very important to talk to them, because they are, for them it's like okay, zabardast, I'm going to be pain free, and when it doesn't happen they come back and they're really really disheartened and disappointed and not happy. So if you sit down and talk to them कि भाई there is no other option, this is what we can. आगे था सैंपल कुछ?
सैंपल सर उसमें आया, अभी स्लाइड बना रहा है लेकिन और रिक्वायर्ड
हाँ? नहीं, ब्लड तो ठीक है अपनी जगह, लेकिन कुछ उसके अंदर बीच में टिश्यू भी होगा.
है सर उसमें. अभी वो स्लाइड बना के अभी आपको दिखा दूँ.
अब एक कोर आया है नहीं आया यार?
और आया है, ये भी छोटा है.
क्लॉट कह रहा है, अगर वसीम क्लॉट कह रहा है तो that will be disappointing. मेरे हाथ से पूरा लगा.
मैं सर कर देता
गॉस तो रख देते
हूँ.
हैं.
बहुत सारे वो ये
it
रखे हुए
was right
हैं. ये
there
रखे.
in the note.
हाँ?
It was right there in the note.
क्या चीज़? या नो, आई एम प्रीटी श्योर उसमें सैंपल होगा, ऐसा नहीं, आई डाउट इट. The thing that I was telling Khalid, and again maybe this is because अब मैं can you appreciate here? Can you see this? Hello? Anybody there?
Yes, we can see it.
Okay, so I'm now bringing my needle out. I've set, this time I did not touch the thing because I had already set the thing, but this is something that happens with us, Khalid, because you use brand new needles every time, right?
Yes.
So nobody touches this. Manufacturers set this up and send you probably a 2 or 1.5, I don't know. But in our case, it actually is moved when they're cleaning and all that. So
Okay.
it is important, and one of the things that we have to be very careful with, and this is totally for our part of the world, is when you take this needle out and it does not come out, then you need to stop and reposition your sheath. Do not keep on
Pushing,
the
forcing
needle,
it.
otherwise you will actually cause problems with your
Scope.
scope. Okay, so we are in this thing. This time I just need a not getting the right place. I need to come here and go all the way. That's better. I'm using elevator now to bring it down. I'm using my elevator. It's smaller lesions, and now I have to use my big wheel. So I'm getting, so you can use with the bigger things. I think you need the elevator doesn't usually work that much. So I think I've sampled from most part of the lymph node, and hopefully that should be enough. Khalid, any comments?
I think you have a tissue on that, on previous one, right?
We've got tissue before,
And
and
you
this is
should-
going to go into saline for gene expert. Okay,
I think you should have enough on that too, so we're pretty much
so
done.
we are done.
Yep.
Where was-
साथ
जी
खालिद दादा तो कहते सिर्फ 3 पासेस करने, तो आपने 10 पासेस किए.
सर, मैंने इसलिए किए कि वो मुझे उसकी जो हॉरिजॉन्टल और लेंथ वाइज नीडल उस तरह मिल नहीं रही थी.
Now, I think that is reasonable. It's like एक तो ये चीज़ है कि length
the
इसकी lymph
length
node की
is-
बहुत कम थी.
the vertical
So in
length
this
was-
case, you
yeah.
won't get that much tissue. Yeah. So in this case, it's very reasonable to go 5, 6, 7 times because the lymph node is the length of penetration there is really small.
What did you do then?